allergies, unfortunately COVID. We were talking about this, like I said, this sort of like, however we want to say it, I don't know, medically, like snot check, burger check, whatever it is. But I mean, do you recommend that if people are blowing their nose, they take a peek at what they're looking at?
Absolutely, yes. So you'd be surprised what your snot could tell you. So definitely a good idea that if you are producing snot or coughing up phlegm, so mucus from the throat, it's a good idea to, look at it and actually, examine it, and it could tell us a lot of things.
What are we looking for? Obviously, you can come in too, but what if there's a telltale sign of allergies versus something else? What should they be looking for?
So at American Family Care, we do recommend always coming and seeking advice from a provider, but there are things that you could do beforehand to kind of decide whether you really need to go in or not. And a big thing with that is the color of your snot. So you look at the color and actually the smell, and the frequency of it. So like if it's clear or white, then more likely it's related to your allergies. If it's darker colors, then can indicate a worsening infection. If it's green or yellow, could be just a mild infection. And if it gets darker, it could indicate, or smellier, it could indicate a worsening infection. So we always recommend seeing a provider, coming to our clinic in Naperville, and I always seek advice from a professional. But in general, there's lots of brands out there. Typically, it's an antihistamine. So you could do Zyrtec, Claritin, Allegra. There's the non-drowsy ones that you could do. And then we also recommend a nasal spray as well. That helps with your sinuses. It decreases inflammation. Some of them have anti-inflammatory substances in it, which could also help with your symptoms.
Okay, and obviously if you suffer every year after year, and you've just had it, that's when you maybe want to go to an allergist and see about some of those other options.
And there's different kinds of allergists. There's an ENT allergist, there's an immunology allergist, pulmonology allergist. So that's also a whole different world. So we always recommend stopping by a provider first, like an urgent care or your family doctor, before going to a specialist, just to decide which route you actually need to go.